Hello, hope you're doing well. This is the start of section 2. By now you've probably taken your section 1 exam. I hope you felt like you got the score that you deserved. But we're going to go ahead and move on. So this is where we're going to start looking inside the brain and identifying certain parts and their purposes. Okay, so here's that page again that we're just not going to cover. Again, if you want the definitions, I've gone through and created a Quizlet for it. Just go ahead and search it up, and it should be under like Exam 2 definitions. Really love Quizlet. If you haven't used it before, it'll have all the definitions in like flashcards, or you can even do games with it, like matching, or even do like a test where it's gonna ask you what's the definition of this, and then it will give you like 4 different things. So you can quiz yourself and actually go through there and see what you don't know. But let's go ahead and move on. Here's, I've laid it on its side just so it's easier to see. So if you're gonna color this or label this along with me, just go ahead and flip it along to where it's sideways, just so you can see it from the same angle I am. But let's go ahead and go down. So let's go through these. So number 1, that cerebral cortex, it's going to be in this purple bluish color right here. Number 2, that's going to be your corpus callosum. It's made out of white fiber tracks of axons that connect the 2 cerebral hemispheres. So this is the cerebral hemisphere, the one that lines up right next to it. It's the other cerebral hemisphere. So, number 3, that's going to be your thalamus. So that's what's in this lighter blue color. Your thalamus is a relay station between your brain and your spinal cord, and it sits right underneath the fornix, which is number 23. Number 22 right here, that's going to be your septum pellucidum. So it just divides the lateral ventricles. And I think if you pull up one of the complete anatomy videos I did, you can actually see that a little bit better. But it's just a partition or wall between those 2 lateral ventricles, like I said. So number 4, that's going to be your pons. So we're going to come down right there. Your pons is kind of like another relay station almost, but it allows both of your cerebellum to communicate between the 2 of them. Uh, the cerebellum, they work together for coordination, balance, and equilibrium. So they just communicate between the 2 right there. Number 5, that's going to be your medulla. That's right underneath the pons. That controls your heart rate, your respiration, your temp, your blood pressure, and that's also where your cranial nerves 9 through 12 kind of originate from. Not kind of, they do. 6 again, cerebellum. 7, that's your spinal cord right there. If you're having trouble remembering the order of these, just remember P, M, S. Pons, medulla, spinal cord. Number 8, we've already talked about this. That's your pituitary. And it's sitting inside of the sella turcica. And it secretes hormones or produces hormones. You remember what these are? It's you're gonna pet your pituitary for your progesterone, your estrogen, and your testosterone. That's what comes out of there. Your hypothalamus, right? We had our thalamus. Hypo, meaning below, is your hypothalamus. And it kind of makes this W shape right here, so you can see. So that's your hypothalamus. It produces hormones. Goes along with like your eating, drinking, and sex drive. So you have your pituitary right here, your hypothalamus right here, and in between the 2, that's your optic chiasm in this light blue color right here. Number 11, it's going to be anterior of your hypothalamus, and that's going to be your anterior commissure. So it allows your olfactory nerve to communicate for smell. It also helps you to remember smells. Um, so if you remember, your olfactory bulbs are sitting right here, cranial nerve 1. These just help them to communicate between the two and to remember the smells. Number 12 is directly posterior to that anterior commissure. This is your posterior commissure, and it allows for ocular motor nerves to communicate eye movement. Okay, keep it simple. Cranial nerve 1, right? Your olfactory bulb. And if you remember the picture of your eyes, right? You have that optic nerve coming back, optic chiasm, optic tract, and then that information gets registered back here in the occipital lobe. So of course, that posterior commissure is gonna coordinate with those eyes, right? Just keep it simple. 13, if you keep going directly past posterior, that posterior commissure, there's number 13, that menial body. So that works with your sleep-wake cycle, or what some of you may know as your circadian rhythms. That is your internal biological clock, and it produces melatonin. Number 14 is inferior to your posterior commissure. It is your superior colliculus. It works by moving your head and neck towards visual cues. So you'll see stuff happening in your peripheral vision, and your superior colliculus picks up on it, and that's what moves your head. Like if somebody like throws a ball to the side of you, you kind of like flinch, out of the side. That's because like you're seeing this, and it's just making your head move. The one below it, inferior, your inferior colliculus, that's going to move your head and neck towards auditory cues. Somebody's like whispers in the library. When you hear it, you're going to turn your head, right? 16, we've covered it before, frontal sinus. 17, sphenoid sinus. 18, 19, and 20, those are your nasal concha, superior, middle, inferior. 21, talked about this already, calvarium. You remember what bones of the skull make up that? You're doing good. If not, I invite you to go back and look that up. Again, septum pellucidum, 22, 21, well, 23, cornix. If you remember what makes up the CSF around here, is the choroid plexus. And 24, some people call it your Dens process. It is coming off of your C2 vertebrae. If you get a fracture on this, this is often called your hangman's fracture, mostly because this is going to break off and it's going to cause damage to this. If you cause damage to this, you're just done for. There's no really communication for the rest of your body. You just die. Things that can cause it is like hanging yourself, even severe cases of whiplash can cause this. It just causes damage to the spinal cord, which can cause paralysis and um, cause damage to your respiratory system, just because it's not getting that communication on how to work properly. Another thing that you need to know is your PMS, pons, medulla, and spinal cord, that makes up your brainstem. That's what your brainstem is. So just to keep this video short, I think we'll just go ahead and end it right there. We'll just scroll down right here so you can get the view of this. I encourage you to just pause the video right here and see if you can go through and label everything that we covered in the previous page. I felt like this was a really good activity for me when I was studying this. I went through it like once or twice and had everything down. So just to point a couple things out, hypothalamus, right? Pituitary, optic chiasm, thalamus. Oh, one thing I didn't cover, that little dot right there in your thalamus, that is your massa interna. Sits right on there. This is your anterior commissure, posterior commissure, superior colliculus, posterior colliculus, pineal body, fornix, septum flucidum. Really good practice right here. So find a picture, use it a couple of times, definitely get it down. So hopefully these are helping. If you have any questions, just let me know in the comments, and please like if the video helped.
All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.